Thank you so much, and good morning, everyone. I'm really pleased to be here, and we have a fantastic panel to lead off our second day of this workshop. We have two panelists who will be speaking about policy strategies for promoting physical activity. We have Dr. Amy Eyler, who is the assistant professor and assistant dean of public health at the Brown School of Social Work at Washington University in St. Louis. We also have Dr. Jamie Shriki, who is a professor at the University of Illinois at Chicago. Both Jamie and Amy hold tremendous leadership roles across the country, which you can read about in your program. But because they are going to provide us such amazing information, expertise, and dialogue, I don't want to spend more time on their bios. I want to spend more time having us hear from both Amy and Jamie, and say that 5 times in the morning, and then we'll have some good dialogue afterwards. So, Amy, welcome.
Good morning. That was an uncaffeinated response. I'm so glad to be here and really enjoyed the sessions yesterday. It is just so nice to be in a room with people who share the same passion and same interest in research, and hopefully today it will be the same. So this is probably the only session where the presenters' first names rhyme, Jamie and Amy. The way that we're going to present this, we work together a lot on a bunch of different projects. I will present an overview of how policies are promoted and used to facilitate physical activity, and then Jamie will present a lot of the evidence within the sectors that we describe. How to work this? There we go. So why policy in the first place? If you think about it, I'm sorry for the picture over there. It's scary, isn't it? If you think about policies, they have the potential to impact a broad community or a broad population, more so than individual level interventions such as aerobic classes. And once in place, policies have the potential to be more sustainable than trends like wearing leg warmers, but they can reach a large percentage of the population and remain sustainable over time. And if you think about the impact that in the innovation that public health has had over the past decades, a lot of the major impact has been attributed to policies. If you think about sanitation, fluoridation, drunk driving, tobacco, all of those policies impacted the behaviors and population public health. So how can this be applied to physical activity? In many different ways. As Russ indicated, physical activity is a complex behavior. It's not going to be one specific policy or one specific intervention that's going to make a difference. So policies can improve access. They can change the way communities are designed, the way a community has opportunities for physical activities, such as bike lanes or parks. They can regulate. If you think about state laws related to physical education and how much and the quality of physical education, that would be an example of a regulation of a policy. They can promote things. So programs like Let's Move or other national campaigns are funded and policies are put in place to promote physical activity. And policies can also provide funding, and this funding can happen at state down to local levels. And they can also coordinate efforts, and that's particularly applicable to state policies and state laws. There's a lot of state laws that create these councils or boards that bring together all the activities within the state to share resources and information. So what is physical activity policy? Just like the definition of policy itself, when applied to physical activity, it is a broad policy. So it can be a legislative action, organized guidance, or just a general rule. Also, it can be more informal in the form of a written code or just common practices. So it's a broad scope of definition for policies. And just to give you an example of a policy, one of my projects, I have been collecting an inventory of state laws related to childhood obesity since about 2005. And we look at 27 different categories of legislation and just look at the quality and quantity over time. And I come from the state of Missouri. Actually, I'm not from Missouri, but I live there now. And Every year since 2009, there was a law introduced that requested the jumping jack be the state exercise. So yes, this is a physical activity policy. Happy to report that it was finally enacted last July after 5 or 6 tries. Apparently it was created by a person who lives in Missouri. John J. Pershing introduced the jumping jack. So while this is a physical activity policy, unless it requires people to do jumping jacks for 20 minutes 3 days a week and enforces that, it really is not a very strong policy as the physical activity policies go. In comparison, and it's difficult to see, but this is a law that was enacted in Oklahoma that gives specifications of physical education in school and makes improvements to the curriculum, and it is put in law and very detailed. So you can see that there's a broad range of impact and potential impact from these different types of policies. Back in 2006, colleagues at CDC, actually I think it was 2004 when this first started, created a physical activity policy framework that sort of outlined these different sectors and different scales of policies that can impact physical activity, from national, state, local, and down to the areas, much like the sectors in the national plan, that can affect physical activity. And so later in the presentation, I'll go through each of these 5 and give some examples of some policies that are in place. As Russ indicated, the National Physical Activity Plan outlines strategies and tactics within each of these sectors, and even some overarching cross-sector ideas that policies can play a huge role in. We talked a little bit about this yesterday for those of you who saw the sessions, but the healthcare sector is really important related to physical activity. And policies that relate to physician counseling and reimbursement are very important to facilitate physical activity. But unless there is a diagnostic code that physicians can put on their chart in order to be reimbursed for physical activity counseling, aside from any comorbidity, there will be less impact. Also, a system of referral. We talked about yesterday how physicians can communicate with community partners to have a place to refer patients to, not just give them a prescription and say go exercise, but actually give them more detail to where to go within their community. And then provider training, not just current physicians, but what type of curricular changes can be made in medical school to facilitate policies related to counseling and giving advice on physical activity. This is a quote from an article by Chen. Physicians need to change their paradigm and start considering physical activity evaluation and exercise prescription as essential parts of patient care. Exercise prescription needs to be as equally as important as medication prescription. And the Exercise is Medicine is a program that promotes this as well. But policies need to be put in place and implemented and enforced in order for this to occur. Obviously, there's barriers, lack of support for these initiatives, not necessarily support, but prioritization. Physicians in the medical care system are overwhelmed, and policies related to physical activity counseling is not one of those priorities. Lack of personal interest or knowledge. If you ask physicians, do they know what the 2008 physical activity guidelines are, your answers will be varied. And then time is always a barrier when it comes to providing health care, cost, and integration of service. There are some interventions that use ancillary health care workers to give advice and counseling on physical activity, but those are difficult to coordinate and maintain. So the next category is transportation, the transportation sector, and these are 2 federal examples. I think SAFETY-LU is probably the worst acronym ever. Safe, Affordable, Flexible, Efficient Transportation Equity Act, a legacy for all users. That's a really long acronym. It did replace iced tea, and it's not spelled like the drink or the wrapper. But these two programs provided funding not only for transportation in general, but carved out funding for ways to promote active transportation, more so in Safety Lou and less so in the MAP 21, which replaced Safety Lou in 2012. Programs such as Safe Routes to School really grew out of these federal funding programs, and with federal funding, states are designated certain amounts, and then the states distribute those amounts by different means. Safe Routes to School was a big component of these transportation bills, and these promote safe ways for kids to walk or bike to and from school. They fund infrastructure, so things like crosswalks, better sidewalks, and educational programs that can go along with that. They're being evaluated for physical activity, but not only physical activity, how these programs impact BMI and other social factors like neighborhood awareness. Another category, someone had a very similar picture yesterday of a sidewalk. How communities are zoned and planned makes a big impact on whether or not people feel safe or have the opportunity to be physically active. Sidewalks are a big component of communities. If walking is the main exercise in America, but people don't have safe places to go to walk, that can definitely be a barrier. And not only building of these sidewalks and places where people can walk, but also maintaining them. As Russ mentioned, the Guide to Community Preventive Services was a review of the evidence and made 3 recommendations that relate to this particular sector. Community scale urban design and land use policies are a recommended strategy for increasing physical activity, as well as street scale urban design land use policies are also recommended. And as indicated, just increasing the access and promoting that access is an evidence-based recommendation, of which policies can play a big role. This is from Smart Growth America. In a survey of Americans, if you look at the second data point here, almost 3/4 of Americans feel they have no choice other than to drive their car to get places. So we have a lot of work to do as far as changing not only the infrastructure, but then changing the mindset of a car community. And over half would like to spend less time in a car if they could. Which leads to the next big policy area related to community planning is complete streets. The concept of complete streets is that streets should be built not only car-centric, but also keep in mind all users of the road, so pedestrians and cyclists and those who use public transit of all ages and abilities. So there's this concept of complete streets that is being put into policies across the country, state and local, put in place to where they build a new street, it needs to take into consideration these other users as well. And it's taking hold, and as of 2014, there were almost 500 of these policies in place. Now they range in scope and strength, but there are over 500 of these policies, and there are some really good examples. Boulder and Portland both have complete streets policies in place and have tracked and evaluated it with really good results. Transportation is another, or public transportation is another area. Americans who use transit have to walk to and from the transit stop, and that adds physical activity to the recommended 30 minutes a day. One of the reasons I love coming to DC is coming from St. Louis, where we don't have good public transit where I live. I feel so empowered to be able to walk to a transit stop, get somewhere, and then walk back. So that consider yourself lucky if you live here, because we definitely don't have that. Again, this is from Smart Growth America. Not only having the public transit in place, but maintaining it and expanding it as the community changes. This picture depicts sort of an abandoned bus stop and an abandoned bike lane within a community. We did a survey through the Physical Activity Policy Research Network, a national survey to gain insight on the perception by Americans of their support for physical activity policies. And one of the sections related to public transportation. So we asked, do you think your city should allocate funds for building or maintaining public transit? And about 65% of the people responded yes to that question. But when we added the layer of would you support a tax increase to pay for that public transit, it was barely half. And if you think about it, a lot of these type of policies are ballot issues, and you need a majority to pass. And in St. Louis, our extension of our public transit system in the city that was related to a tax increase had to be put on the ballot 4 times, and the 4th time barely passed. I think it was just barely 52% of the voters approved it. So there is support, but funding remains an issue, mainly due to priority of what people think a community needs. As we indicated, giving people access and opportunities within their community to be physically active is important, and promoting those places or those trails or parks is equally important. In a study that we did, a focus group study of women across the country about physical activity, why they do or don't do this behavior, we asked them, are there places in your community where you can go be physically active? Are there parks? By far, the majority of the women said yes. Well, why aren't you using them? Well, they told us that they're not maintained well. One quote that sticks in my mind is a woman said that she has to walk over homeless people to get to the park. Another woman said there are dirty needles at the end of the slide. So things like that. It's not only building and putting policies in place to have access, but then maintaining the quality of those parks is equally important. Trails is another example. People who live near trails have easy access to physical activity, whether they ride their bikes, walk, rollerblade. It provides easy access to be physically active. And policies that facilitate building, maintaining, and connecting can promote this behavior. Connectivity is another issue. It's not just a matter of having some sidewalks and some trails, but connecting them so you can have destinations. This actually is at the top of my street. My neighborhood has sidewalks. Then there's about 3/4 of a mile with no sidewalks, and the sidewalks don't connect till after the street light in this picture. And as I'm sure many of you do, you carry your camera with you and you see these opportunities and you seem like the creepy stalker with the camera, but I did talk to these people, and they were visiting from California and just wanted to take a walk to get ice cream. There's an ice cream store at the end of the street, and struggled with their stroller and their young children on this dangerous road. So having policies that connect these roads to make sure that the destinations can be reached safely is another important aspect of policy. Open streets is another policy-related physical activity opportunity, started in Bogota in the 80s, and it's where streets are closed for a period of time, closed to motor vehicles and open to physical activity opportunities. And even though these open streets may take place once a week or once a month, they provide individuals within the community an opportunity to interact with one another. They can be made aware of places to be physically active. They can build their confidence in riding their bike on the street. So these open streets are taking hold. There are about 100 cities in the United States that hold some form of these each year, and are currently being evaluated for their effectiveness. Joint use policies are another policy that can affect physical activity. These are between schools and communities, and the schools are already there. They're relatively low cost. These are public buildings and public facilities within the local community. But the barriers are maintenance issues. Pristine soccer fields aren't meant to be played on as indicated by this sign. There's liability issues and just the facilities themselves. So those are all sort of public policies. Switching over to more an organizational policy. Policies and work sites can facilitate physical activity. The majority of Americans work, spend a lot of time at work, so it's a good opportunity to facilitate this behavior while we have a captive audience. Policies such as flex time, facilities, not only gyms, but what about bike racks or lockers or places to change are also important. And active transportation incentives and also disincentives. So lack of parking or high parking prices, and then couple that with making it easy and removing barriers for active transportation can facilitate this behavior. This is an example of what's happening on our campus. So we, at Washington University Medical School, we share our campus with Barnes Jewish Hospital, a complex. It's a huge complex that, as you who work in academic institutions realize, that there's always construction in new buildings, and you can walk over a mile indoors with all the inside building connectors. And so money was put forth, and policies were changed within departments to allow people time to take walks around campus, and they're well marked. It's called Tread the Med, catchy name, and people still use this. This has been around for about 4 years. Things like standing desks, gym subsidies, encouraging breaks. We promote walking meetings. Those are all sort of informal policies that can promote physical activity. And lastly, probably the most obvious and the most well-studied is physical activity policies in schools. This is from the IOM Report, Educating the Student Body, that Bill Cole led in 2013, identifying opportunities before school, during school, and after school to promote physical activity among children and adolescents. I'm just going to go. I got the 1 minute, so I'm going to skip that one. So we have PE, we have recess. Those are opportunities within the school day to promote physical activity. Recess is important, but being cut. So policies not only that promote recess, but discourage or require schools to not take away recess for punishment is another example of a policy. Pulled this one out from 1895. No schoolhouse shall be considered in the city of New York without a playground. It's a long time ago, before parking lots. Before and after school activity, there's plenty of opportunities to promote physical activity. Policies saying that a certain percentage of time in these after-school programs need to be dedicated to physical activity. Final thoughts. Gave you some good examples about how policies can affect population physical activity. Definitely needs culture change. It'll come over time. If you think about tobacco, it was common to walk into an office and see an administrative assistant smoking a cigarette. We don't see that now because of the culture change and the policies. And it's this convergence of top-down and bottom-up policies that can make a difference. There's the arch, and I inserted a picture of a child doing a jumping jack because it's the state exercise. Thank you for your attention. And
thank you so much, Amy, and really pleased to learn about the origins of the jumping jack. I didn't know that until today, and much, much more. And Jamie, welcome.